But let's talk to Dr. Ken Aswani, because the front page of the Daily Mail today says, say goodbye to your doctor's appointment. Patients are facing months of misery after GPs launched industrial action that will see some slash their appointments by half. Dr. Ken, very good morning to you.
Good morning.
So, I don't know whether you're in the BMA or whether you would have voted for industrial action or whether you are indeed a GP, actually. So you can tell us the answer to all of that. But what's this all about, and how bad is it going to be?
Yeah, so just taking a neutral view, first of all, just from a point of view of patients, it's important to say this is not a strike. Doctor surgeries are not closed. And certainly patients with important symptoms should still very much come forward, because we don't want to sort of delay any diagnoses. I think that this is part of a sort of a collective action that the profession had sort of said, and they've left it to individual practices. So it's very actually difficult to say what impact it's going to have. There are 10 potential actions that individual practices can take. The main one that gets the headlines is to limit consultations to 25 per GP on the basis of safety. But this is going to vary from surgery to surgery. So at the moment, it's very, very difficult to see what the impact is going to be, but it's important that patients still present and consult their surgery as normal, and sort of just ensure they get their care. And we just have to make sure patient care and the system is running as effectively as it can.
Yes, indeed. I mean, there's an awful lot of GPs in Britain, and not all of them are in the BMA, are they? I mean, it says, I think here, that 8,500 GPs responded to the ballot. And so, I mean, that's quite a small proportion, I believe, of the number of GPs. So presumably an awful lot of GPs' surgeries won't be taking any action at all.
Yeah, I mean, I think that it is going to vary up and down the country, and it is going to be up the surgery, so it's going to be very difficult to sort of keep tabs on it. But it is going to be up to the surgery. Obviously, the concerns the profession has, but at the same time trying to resolve it for patients and the system. So yeah, I think it's a waiting to see, but we just do have to make sure, yes, we do take on the concerns, but also we kind of mitigate and make sure a very important service runs as effectively as it can.
Yeah, but I mean, it doesn't run very effectively at the moment, does it? Which is part of the reason why supposedly GPs are going to take this action in the first place.
Yeah, I mean, I think the concerns in terms of sort of are well publicised. I mean, clearly the sort of in terms of demand, which has increased post-COVID, certainly in terms of workforce and the number of GPs. And I suppose that what the profession is saying is that they want to be on a sustainable footing, because, okay, they might just be able to sort of survive now, but what happens in sort of 5 years' time, etc., they want to be able to run their surgeries and provide the service for patients in the longer term. So I think that that's why this is sort of probably surfaced at the moment.
Yes, I mean, I understand Wes Streeting, the Secretary of State for Health, though, has offered the opportunity for an amount of money which GPs can now, at the moment, not use to hire other doctors to help them out. He's going to free that up so that they can use that money. So does that make a difference?
I think that's a really positive move, really, because the GPs do have access to a budget, but they can only use them for other professionals, right, which are very good, etc., but not for GPs and nurses. Now, fortunately, the announcement that's been made recently can be used for GPs and nurses, and that means more appointments for patients, and actually also means that GPs who qualify actually get work, because obviously we don't want a situation that we spend 10 years training GPs and they're not able to find work. So my opinion would be that that's a really positive and a welcome move, right, and I look forward to the benefits.
But shouldn't that have had some effect then on the decision to go to take industrial action? I mean, surely that should have been something that they could have taken into account before they'd made the decision.
Yeah, I think that decision is just that announcement has just been made sort of effectively in the last 24 hours. But I understand the profession is looking for sort of longer term sustainable funding, because I think the sort of contract increase value they said was 1.9%, and obviously a lot of practices feel their costs have gone up considerably more. So I think they want to, in a sense, sort of get on a sort of an even keel, be able to provide that. I think having GPs or more GPs is one aspect of that. But obviously, the practice has to sort of run just like any other business. And I think that's what the discussions are going to be about.
Right.
Well, from my point of view, obviously, the sooner we can resolve from both sides, the better it is. But it's kind of looking at slightly two different things, really.
Yeah, I mean, what's your situation if you're a GP, for example, today? What's the most difficult thing that you find? Because I'm going to be speaking to another GP a little bit later on in the show who tells me whenever I speak to him, and we always have this sort of backwards and forwards banter about the fact that he does 3 days a week as a GP because he says he can't do 5, it would burn him out. And what's your, if you don't mind telling us, what's your situation?
Yeah, so, I mean, from my point of view, I work as a sort of GP, sort of 3 days, but I also do clinical management as well. So you find a lot of GPs have a portfolio career. It's not just about avoiding sort of burnout. That's quite normal for GPs to do that. But remember, sort of GP's working day can be 14 hours as well. So a number of my colleagues do work 4 days. There are still GPs that work 5 days. So I think it's more difficult because the days are very long and the demand is very, very high. So I can understand GPs not working the full 5 days because they probably will burn out. But also, if they work part of the time in clinical practice, but part of the time in education, research, clinical management, that's also helpful. But that's still a lot of patient contact time, and I can easily have over 50 contacts per day. So, you know, we do want to maintain that because that's the core purpose of GP, really.
Right. But, I mean, if, for example, during this period of industrial action, you're only going to see 25 people a day, that's going to cause a massive problem, isn't it?
Yeah, I mean, any decisions haven't been made locally, certainly not in my practice, but we prioritise patient care. So, you know, whatever the sort of advisory sort of elements of that, we'll make absolutely sure that patient care is not compromised. And, you know, we won't just stick to an arbitrary figure so patient 26 doesn't get seen or anything like that, because that's our core purpose, really. And, you know, even one patient having a delayed diagnosis is not a good outcome. So we'll make sure patients are not adversely affected, but we're aware that colleagues sort of feel that, you know, they're almost sort of wanting to sort of take a stand when they can understand that viewpoint, really. But yes, patient care has to be on top of the list of what we protect, I think.
Yes, well, let's hope so. Dr. Kenneth Smiley, thank you very much indeed. It looks to me as though there are something like 54,000 GPs in the country. Only 8,000 of them voted for this BMA move to actually decide to shut down the ability for you to see a doctor. So I think it probably you'll probably find that most doctors' surgeries won't actually follow the BMA line, but we shall see.